Hello and welcome to ASM Live, the interview talk show for the 2010 American Society for Microbiology General Meeting. We're here live in San Diego, and I'm Jeffrey Fox, the features editor of Microbe, the monthly magazine of the Society, and your host for these sessions. I'm talking with microbiologists and other scientists who are presenting their findings during the course of the meeting, and during these interview sessions you have an opportunity to ask them questions. There are several different ways to do so. You can use, if you're watching by Ustream, please submit via the chat room, and if you're using Twitter, use hashtag ASMGM. And for those of you in the live audience, we ask that you raise a hand, wait for a microphone, and then identify yourself by name and affiliation. Okay, in this session, I'm talking with Gregory Gray, who is from the University of Florida, Gainesville, and we're going to be talking about monitoring the H1N1 influenza virus in swine and possibly in other animals. And what I'd like you to do to begin with is to give me about a 2 or 3 minute summary of your findings, and if you'd like to talk describe the session that's going to be held this afternoon, just to give people an idea of how broadly this sort of monitoring is being done, that would be good too. And then we'll get into questions.
Okay. Well, thank you very much, Jeff. So I'm an infectious disease epidemiologist and often do studies at the human-animal nexus. And we've studied a number of human populations that have intense exposures to animals, exposures to birds, both domestic and wild, pigs, and even horses and camels. So what I'll be talking about today is some of our work as it concerns the exposures to pigs, and then what I know about the surveillance for influenza in the pigs. We have found, in fact, in our studies, our epidemiologic studies of pig workers, that the swine influenza viruses readily cross over to the workers and frequently to their spouses who have no swine exposure. So there's evidence of this both in a cross-sectional historical way and then over time in some of our studies. So we're really concerned that we keep a good handle on the types of viruses that are in pigs so that we can anticipate what sort of novel viruses might come out of pigs and affect man.
Okay, and if you don't mind going on to describe a bit about the other animal systems that some of the other presenters will.
So in the symposium this afternoon, we'll be talking about the experience of surveillance, if you will, for influenza viruses in humans, in birds, and also in horses and dogs, looking for evidence that novel viruses might originate or mix in those different species and cause problems to both man and to the animals. So we're going to hear from experts in those areas.
Okay, so so far you've indicated that you've set up a monitoring system and that you're going to keep watch. Do you have any preliminary findings of beyond H1N1, or are you seeing H1N1 predominantly at this point?
Well, let me say that we don't really have a good monitoring system in pigs at this point. The surveillance in pigs for novel viruses is very spotty. It's a surveillance system that's voluntary. In fact, having influenza in pigs is nothing extraordinary. It's typical and not a reportable event. And so while there's been some effort to find ways that we could do more aggressive or active surveillance in pigs, much of the data I think that we would need to say that that has happened, much of those data are missing. So the surveillance studies, or the studies we have, are basically snapshots in time for finite populations of people. And we know some data that our veterinary colleagues at the diagnostic labs have captured, which are also small snapshots in time often and only proportions of positive specimens. So I would say at this point our knowledge of what's circulating in pigs, not only in North America but throughout the world, is very spotty.
Okay, but are there any hot spots for monitoring? And by that I mean not that you have high levels of H1N1 necessarily, but that somebody is really doing solid, up-to-date work.
Well, we know some things in both historically through studies through our veterinary diagnostic labs, and then more recently, we know through some of the studies, for instance, of the veterinary labs and some of the veterinarians in Canada, that where we see the most prevalence of swine influenza in the pigs is in the intensive farming, the confined animal feeding operations that have large populations with constant introduction of susceptibles. We know that both for the finishing herds and the sow herds. So if it's large and it's continuing, there's a good probability you'll see viruses. Now the facilities do a great job at trying to reduce the introduction of viruses through man or fomites or trucks or whatever, but nonetheless they're always trying to stay ahead of the viruses in those facilities, and when they have clinically ill pigs, they'll evaluate them. We know from the evaluation of clinically ill pigs, at least a snapshot of data that was recently released from the University of Minnesota, that the pandemic H1N1, at least in the 35 specimens they sequenced, accounted for about 19% of this calendar year of their swine influenza isolates.
19%?
19%.
So it was a relatively small proportion.
For going from none until 19%, okay. I think it's caused them to be concerned. You know, it's something to think about, particularly when you realize that you can have multiple different viruses in the same herds, which could reassort or recombine to generate novel viruses.
Okay, so H1N1, even though it was called swine flu, didn't take over the swine population. It hasn't had the same impact on pig herds as it has on the human population.
Well, we're not seeing evidence of that just yet, but we should balance that to say that in 1918, it appeared that man introduced a H1N1 virus that has been endemic in pigs since that time. So we have basically, that's known as the classical H1N1, and there's evidence that the H3 pandemic was also introduced into pigs, and that's remained as well, or variants thereof. So there's a lot of concern that this pandemic H1N1 might become endemic and contribute to the variety of influenza viruses that reside in pigs. Okay, so
I don't know anything about the dynamics of and the demographics of H1 or of any sort of flu in pig herds. I do know that there's not much activity of H1N1 in the human population in the northern hemisphere right now. But do the pigs continue to circulate flu viruses during the summertime and in the northern hemisphere, or do they follow the typical winter peak period of disease?
My understanding is that it's a year-round problem. We see perhaps an increase in the colder months in the pig populations, but it's not the same sort of problem that we have in human medicine, because it rarely causes severe disease. Perhaps in combination with other respiratory viruses, the pigs can suffer greatly. But for the most part, it's a transient, mild disease. And so our colleagues in veterinary medicine and our colleagues that do pig farming, it's really not a big problem, at least for them. So, you know, it's something that they live with along with other viruses like porcine circle virus and the PRRS virus.
All right, so they don't have much incentive to monitor on their own. The importance of monitoring is more for what might hop over into the human population?
Well, the viruses can reduce their production, so there is motivation to do monitoring. And they do base vaccine constructs on the viruses that they identify, but what I'm trying to communicate is that it's not the severity of disease that we see in humans, and the reporting is not a requirement. And also the voluntary nature of sharing that with others is not a requirement.
You mean they may keep it to themselves rather than...
You can restrict the information that is shared, for instance, with public health officials.
Okay.
In some settings. And so while we're coming up with both with USDA plans and FAO plans to better share that information and better conduct surveillance, I think for the most part, most of us in public health would say that the surveillance right now in the swine populations needs improvement. On the other hand, you know, we also have poor surveillance, we could argue, in horses or in dogs.
Although it's my understanding that pigs are the primary mixing species for flu, or is that
Well, actually, I think man could be a mixing vessel as well, and other people have argued that, but pigs have been featured in a number of different articles and arguing that they are, because they have receptors for all the strains and they're the strains readily replicate, that they are a good mixing vessel. So it's a concern, although we must be aware that any host that could have two or more viruses, could be an avian, a duck, could generate a novel virus. It's just that I think we have this unusual human-animal nexus where you have very large populations of pigs in close concentration with pig workers, and there's a potential there for disease transmission across species, both ways.
Oh, right, both ways. And that would be true, I think, with certainly with horses and with other domesticated pets like dogs.
Would be true, I think, for poultry and for pigs, but not necessarily in this country for dogs or horses. In South Korea, they do have confined animal feeding operations, if you will, for dogs, because it's a food staple. But the intense farming where they're closely packed together, much the same as our prisons or recruit camps or schools, you don't see in this country except for pigs and chickens.
Okay, so one of the important points you're making is that the animal population density allows for many more cycles of infection. I was thinking in terms of dogs, for example, of the close relationship that people have with their pets, that the hop of a virus between species would be
Well, we don't really know
easy.
that the influenzas that affected dogs have ever crossed over to man.
Okay.
And the evidence for the equine crossing over, certainly if it does cross over, for the most part, it's mild, and there have been experimental studies. In contrast, we've seen, of course, in recent years, quite a bit of crossing over from bird and pig species. The difference between domestic pigs and domestic poultry with respect to monitoring, though, is pretty clear. Pigs only suffer a mild illness and may not, in fact, in many cases, and some data that are coming out of Norway, about 40% of the pigs with pandemic H1N1 had no signs or symptoms at all in herds that were totally naive to influenza viruses. And so one of the concerns is unless you actively surveil in pig populations and even collect samples from asymptomatic pigs, you may miss a novel virus until it comes out. In contrast, if you get a novel virus in chickens, you know, I would say there's a higher probability that you'll see some loss of production or some signs, especially if it's a highly pathogenic virus. You'll know quickly.
Of course, that's a peculiarity that I suppose there's an uncertainty principle at work there, that what is virulent in one species may not be so virulent crossing over into another. That even though the chickens tend to, the degree of severity in chickens seems to be more closely aligned to that in humans. Am I making?
No, I think you're right. Different species respond differently to different viruses.
So it's a little
I agree with you.
unpredictable. But the mixing and the difference going from pigs to humans is something more to worry about.
I think it is. Of the various different cross-species animals to man, I'm concerned that we watch that more closely. The problem, of course, with doing that is that when we gave the moniker swine influenza to the pandemic virus, our colleagues in the production industry saw their profits greatly
Right, they
plummet.
dove for cover, I think.
And so, you know, that's very unfortunate because it really had nothing to do with pigs. It's just that some of those strains were first seen in pigs. They could have been first seen in birds, but for whatever reason, they were first seen in pigs, and hence the nomenclature. We need to think of a new system of nomenclature that would help us avoid sort of that offensive nature.
Okay, we do have a question from the internet.
Yes, science blogger Cesar Sanchez would like to know, why is it that pigs and poultry are so important for the mixing of human flu? Why not cows or sheep, which we also keep in dense populations?
Well, as far as we know, cows and sheep are not good spreaders of influenza. In contrast, poultry and pigs can have very effective species-to-species transmission and cross in high viremias and such that you could share, you know, the virus to man. Does that mean that we've identified all the species that could surprise us? And I would say no. In fact, there are new things being learned about the potential role of wild animals in adding to the ecology, if you will, of viruses, and not just wild migrating birds, but other animals as well. So it's an area that we need to research when we try to understand how these viruses mix and can cause problems to man. Okay,
it strikes me that you are sitting right in a hot spot of the One Health movement, that this is a really important development in terms of getting veterinarians and human MDs and microbiologists and all the different experts working in collaboration. Are you finding this is working? Is it?
I think we're on the frontiers of new collaborations that'll be very, very rewarding. At our institution, we have something that's called the Emerging Pathogens Institute. It's a multidisciplined, dedicated research facility where we not only work with veterinarians and people in medicine and public health, but also with plant pathologists, people in agriculture. So the sharing of ideas across disciplines is a really nice way to approach new problems. But I'll tell you, the component that we're really missing is a way to protect the pig farmers. And you know, I don't see that they're going to be all that excited about sharing the information regarding the viruses that are affecting their pigs until we can sort of protect their interests. So we need to figure out ways either to receive specimens without any identifiers, such that they're anonymous and no one would backtrace it to their farms, or some way in this country to protect the farmers so that they'll freely share what's causing morbidity in their animals. And that's a big barrier right now, I'll tell you.
No, I can see that there would be sensitivity, although if you subtract too much of that information, you'll lose some of the value in monitoring to begin with, right? You want to know where the viruses originated.
Well, there's a big interest, I should say. It's very important to include industry, and industry is very interested in what viruses are affecting man, realizing that those historically have contributed to loss in production. But the deficit in, if you will, in the economics has been pretty one-sided. It's the industry that's suffered the most, and so we got to think of ways to bring them on board without threatening them, and I think that's a hurdle that we've not yet surmounted.
Without further questions from the internet, I guess I want to wrap this up and Thank you once again. We've been talking with Gregory Gray of the University of Florida at Gainesville, and he's been talking with us about the need to monitor for influenza viruses in pig herds and chicken herds and other chicken flocks, I should say, and other organisms that come in contact with humans. Thanks very much for joining us.